Hello and welcome, my friends. I've come to share with you a very interesting topic today, and a topic which is sometimes missed being taught in undergraduate curriculums across the globe. It is taught in the Indian curriculum, but somehow we don't give it the practical utility which it requires in the modern day world. I'm going to share with you a very interesting book today, and that is Lectures on Homeopathic Philosophy by James Tyler Kent. I'm sure my Indian friends know about this book, but very many times participants or students across the globe in different other countries are not taught this book. Lectures on Homeopathic Philosophy by Kent is a master book which you must have. And from there, I'd like to share with you a very pertinent topic which is very practically applicable, is 12 Observations of Kent. I'm sure many of you know or have heard about 12 observation, but somehow don't use it practically, when in your day-to-day practice with your patients. The name of the chapter is Prognosis After Observing the Action of the Remedy, and it is chapter 35. Now, you'll find a similar discussion about Kent's observations in H. Roberts' Principles and Art of Cure by Homeopathy, and the name of the chapter there is Remedy Reaction. Now, if you see and understand the name of the chapter, Prognosis After Observing the Action of the Remedy, so when you're prescribing and you have made a good first prescription, it is very important to know what to do in the follow-ups. And to be very honest with you, many of us make good first prescriptions, but where we mess it up is in the follow-ups. I'll be reading from Kent's lectures and I'll be explaining as well. First paragraph: after a prescription has been made, the physician commences to make observation. Whole future of the patient may depend upon the conclusions that the physician arrives from these observations. For his actions depend very much upon his observations, and upon his actions depend the good of the patient. That's why homeopathy is a science and an art. The science is the prescribing, and the observing is the art. After the remedy has been administered, many times Kent says you can get aggravation. Now, with the aggravation, that can be aggravation of the disease, that can be aggravation of the symptoms. Kent says when there is aggravation of the disease, that means it's not a good thing. The disease condition has worsened and it's not a good prognosis. Whereas when there is aggravation of the symptoms, and Kent says, but the patient says, I am feeling better, that's always a good sign, because that's a homeopathic aggravation. I feel better. So aggravation of the symptoms can happen, but overall his general health is better, and that is very important for acknowledging that the patient is improving. So very many times, even you're prescribing for an osteoarthritis, you're prescribing for a headache, but the patient says there's not much change with the joint pains, but my energy is better, my sleep has improved, my anger has decreased. So very many times you'll find that when these general sense of well-being are better, the patient is on the right track. I will share with you in a later session that what are the factors which you can incorporate when you are doing the follow-ups. And one of the few very important factors to understand here is, although his present complaint may not improve, but his general sense of well-being is better, his energy is better, his sleep is better, his anger is better. So these are points that the remedy has touched the constitution of the patient. We'll delve into that later on. Now, Kent has mentioned about 12 observations which can be observed after administering the remedy. And we'll start off with the first 6 today. And the first observation of Master Kent is prolonged aggravation and final decline of the patient. So that after a prescription has been made, there is a prolonged aggravation, and final decline means he is not on the path to recovery, but on the path to his deathbed. Now there are 3 factors which are important here. one of the factors you have to understand is the stage of the disease. The disease has progressed to a point where it is irreversible pathological changes. Very many times you can find a disease condition A where there is functional changes, followed by reversible pathological changes, and finally there is irreversible pathological changes. That there has been so much fibrosis in the lungs, it is irreversible. A cancer has metastasized, irreversible pathological changes. So stage of the disease has progressed to a great extent. Second point, you have prescribed a too deep antisodic remedy. Too deep, I will say anti-miasmatic remedy here. But combine that with a high potency. So Kent's points for the reasons of the first observation, which is a bad prognosis in fact, is the stage of the disease has progressed to a certain point where it's irreversible pathological changes. Too deep an anti-miasmatic remedy you have prescribed, and you have prescribed in a high potency. A high potency, Kent always refers 200, higher than 200, so 1M, 10M. And in today's world you will find repeated dosing, too many doses, frequent dosing, that also causes the first observation. So you have to prescribe a remedy which is in the minimum dose and which is either in 30 or 200C, and that is very important for the first observation. You see, I am reading from Kent here again, incurable and doubtful cases give no higher than the 30th or 200 potency. So 30 he shares as a universal potency, 200 as well. But even if you require an anti-miasmatic remedy, you require a medorrhinum, you require a carcinosin, but do make sure you prescribe in 30 and 200 when the pathology has progressed to a point of no return. So in such cases, begin with a low potency and you can always ascend, and this Roberts also confirms that incurable conditions we should avoid giving a high potency of the remedy. Administering a lower potency, we may be able to go on and develop the case gradually until later it may be possible react favorably to a higher potency. So start with a lower potency and sensitize the constitution to a lower potency, and then you can go higher up the case and prescribe a higher potency if necessary later on, if the patient is on his path to recovery. But always it's favorable to start with a lower potency, 30C and 200C. Now very many times you will find when you prescribe the high potency of a deep acting remedy and the patient got an aggravation, he is not on the path to recovery, and that unfortunately follows Kent's first observation. So it's very important to understand the stage of the disease and to be careful in regards to selection of potency. A 30 is always favorable to start in such cases. Kent did not mention his writings about LM potency because that came much later on. The 6th edition was published much later on after Kent's demise. So he's talking mostly about the C scale, and if you are a C scale prescriber, 30C is always good potency for anything and anyone. We come to the second observation, and second observation is long aggravation but final and slow improvement. There's a long aggravation but there is a final and slow improvement. Now there are a few factors here. If you correlate that with the first observation, here there are pathological changes but it has not yet progressed to the state of no return. It has not yet progressed to a state of irreversibility. So there is pathological changes, the stage of the disease has progressed but not to a point of no return. And secondly, the potency which you prescribed was a high potency perhaps, but it still helped the patient to recover. So in the second observation, you just got lucky, to be honest. You made a mistake. You should have prescribed a lower potency. You prescribed a higher potency, but because the pathological changes were not irreversible, you got a chance for the patient to recover. So the aggravation may last for weeks, and then finally slow improvement comes. So one of the major learnings from the second observation, my friends, is Kent says that the aggravation can last for few weeks and then gradually amelioration starts. So whoever of you, especially homeopaths, who are following up the patient every week or every 10 days or every 2 weeks, especially in a chronic deep-seated condition which doesn't require frequent follow-ups, you're doing a great deal of mishap for yourself, because you'll be confused when you follow up the patient in 2 weeks time. There's aggravation, you may be prompted to change the remedy. So always make sure you follow up the patient at least in 4 weeks time, because by the end of 4 weeks, in a chronic disease I am saying, which doesn't require frequent intervention, the patient is consulting for chronic migraine, chronic psoriasis, make sure you follow up the patient in 4 weeks time, because even if you prescribed a higher potency, you started the psoriasis with 1M and the skin got flared up, but gradually after the long aggravation you'll find final and slow improvement. So that aggravation can last for weeks. It is very important to understand that you need to follow up after a considerable length of time. I'll read from Kent's philosophy. Aggravation is long and severe, yet you have a final reaction or amelioration. Aggravation lasts for many weeks perhaps, and then his feeble economy seems to react. So do not be tempted to follow up the patient in a week or 10 days time. That's a very incorrect thing to do, and you'll find an aggravation and you'll be confused, you'll be prompted to repeat again. This man was on the borderline, and had he gone further, cure would have been impossible. So you made the same mistake, you prescribed a higher potency, but he was on the borderline, he has not still gone on to a state of incurability. It is well in doubtful cases to go to the lower potencies. So in doubtful cases where you're not sure of the potency, start with the 30C. Similarly, as I shared with you, for skin cases, for a psoriasis, you don't need an aggravation, start with the 30C. So that's about your second observation. It's a good prognosis at the end of the day, because although you made a mistake, but still the patient was on his way to recovery after weeks of aggravation. You see, you get him a little earlier in his history before the trouble has gone so far, and if you administer the same very high potency, you'll get a second observation. So the pathology has not yet progressed, but you prescribed a higher potency, and such was the final and slow improvement. We come to the third observation of Kent, and the third observation of Kent is always a very good prognosis, because the third observation is aggravation is quick, short and strong. Aggravation is quick, short and strong with rapid improvement of the patient. So quick, short and strong. You see, it corroborates with Hahnemann's guidelines of rapid, gentle and permanent cure. So a quick, short and strong aggravation, but final and slow improvement. And Kent says here, this is what you require in a chronic case or in an acute case as well. That a quick, short and strong aggravation, which is a homeopathic aggravation, but even in that stage the patient says, I am actually feeling better. And then final, you get the patient with rapid improvement. So rapid, gentle and permanent recovery. And again Kent says here, this aggravation can last for a few hours in an acute case, this aggravation can last for a few days in a chronic case. And corroborating that with Hahnemann's guidelines, section 157 to 161, where he mentions about homeopathic aggravation, he says that this aggravation can come in waves transiently in the first 6, 8 or 10 days. So up to the first 10 days you can get homeopathic aggravation, which can come in phases, and then gradually the amelioration start. So that's why I said, if you're following up the patient in a chronic case in 7 days time, it's a grave mistake to do, my friends. So aggravation is quick, short and strong, few hours in an acute case, few days in a chronic case. Hahnemann's guidelines generally for 6, 8 or 10 days, and then improvement starts. And here you have to understand here, where is the pathology for the third observation? The pathology is not always in the irreversible stage. There is no irreversible pathological changes. You see, there is no tendency to any structural change in the vital organs. So there is no irreversible changes in the vital organs. Any structural changes that may be present will be found on the surface in organs that are not vital. Abscesses will form, and glands that can be done without will suppurate in regions that are not important to the life of the patient. So you'll have surface changes, you'll have changes in the non-vital organs, and Kent refers to the vital organs as liver, kidney, heart and the brain. Obviously you can include lungs in that, but Kent mentions in different philosophical chapters that these are his 4 important vital organs. So that is about your third observation, which is a very good prognosis, and this is often what you require in a chronic case. We come to our next observation, my friends, which is the 4th observation. The 4th observation is also a good observation. In fact, the 4th observation refers that there is no aggravation, but finally there is recovery of the patient. No aggravation, so no homeopathic aggravation, but recovery of the patient. Kent says that it is great if you have that in acute cases. So in acute cases there is no aggravation and patient starts to recover, it's a wonderful sign. But in chronic cases you'll have a question mark in your head, that is my prescription correct? Will it not go to 5th observation or 6th observation? We'll talk about that in some time. So there will always be, you'll be skeptical in your head that if my medicine is correct or not in a chronic case, but it is the highest order of cure in acute affections. So no aggravation but recovery of the patient. Now in chronic case, if that happens, that there is no aggravation, that recovery of the patient happened, then my friends, it is you have selected the simile perhaps, that it's the potency exactly suited the case. So the remedy was correct, the potency was absolutely correct, and you hit the bullseye. So regarding 4th observation, Kent mentions, we know that there is no aggravation, the potency just exactly fitted the case. In cures without any aggravation, we know that the potency is suitable. It is the highest order of cure in acute affections. Yet the physician sometimes will be more satisfied in the beginning of his prescribing if he notices a slight aggravation of his symptoms. So if you get the homeopathic aggravation, quick, short and strong aggravation, that is much more favorable than not getting an aggravation, because you are not sure that is my medicine, if my prescription is correct or not. So that is what we get about the 4th observation. We come to the 5th observation. Again, the 5th observation is not a favorable observation, because what happens here in 5th observation, the aggravation comes first and the amelioration comes first and the aggravation comes afterwards. So you got relief at first, the patient comes to you in 7 days time, oh doctor, I'm so much better, my pains are all better, but at the end of the week, at the end of 10 days, the symptoms start to worsen. The amelioration is first, the aggravation is afterwards. And Kent says there are 2 factors here which can happen for the 5th observation to occur. Now very many times, and this I was taught, and just corroborating this with Kent's philosophy, I was taught this by my dad, by my granddad, that the seat of the disease should match with the seat of the remedy. When a patient has come to you with many symptoms, many organs are affected, many spheres of actions are there. He has a headache, he has asthma, he has psoriasis, he has osteoarthritis. So you need a remedy where the magnitude of the disease should corroborate with the magnitude of the remedy. So the seat of the disease is spread out in different organs. You need a constitutional remedy, you need a polycrest which will address those sphere of actions. Now if I prescribe in such a case, just for his headache, I prescribed his throbbing headache, I gave him belladonna. Yes, it will help with the headache, but that help will be very short lasting. So whenever you are prescribing a remedy, the depth of the disease, the magnitude of the disease should corroborate with the magnitude of the remedy, should corroborate with the depth of the remedy. A patient who has been suffering for the last 15-20 years, you prescribe an acute remedy, that effect will be short lasting. So whenever you are studying a remedy, you have to understand these are the sphere of actions. These are the sphere of actions it can cover, and I will need a remedy which can address this sphere of action, and that is exactly, if you don't do that, you will get the 5th observation. One of the major reasons for this is you prescribed a superficial remedy. How a superficial remedy? The case covers a lot of symptoms, but you prescribed a remedy which covers just one of his symptoms. He has mucousy stool, chronic mucus colitis, he has osteoarthritis, he has a headache, He has asthma and you prescribed aloe just for his mucousy stool. So you're covering one part of the case. You address the most grievous symptoms of the case, but you did not cover the whole constitutional state of the patient. You did not cover the miasmatic weightage of the patient. And there you had some relief for 7 days, 10 days, but then the aggravation comes. So the amelioration comes first and the aggravation comes afterwards. Kent's words again. Either the remedy was a superficial one, could only act as a palliative. So you prescribed a superficial remedy which acted as a palliative. You will discover that the remedy was an error. A further study of the case shows that the remedy was only similar to the most grievous symptoms. You prescribed just for the headache belladonna, just for the mucus colitis aloes. So it covers the most grievous symptoms. It did not cover the whole case. It did not affect the constitutional state of the patient. And that is very important to understand. So the depth of the disease should corroborate with the depth of the remedy. The magnitude of the disease, the sphere of action, should corroborate with the magnitude of the remedy. And the second factor here is the patient was an incurable case. So he has gone to a state beyond recovery. So patient was incurable and the remedy was somewhat suitable. So helped it in some cases, but it has gone beyond the state of recovery. So the amelioration comes first and the aggravation comes afterwards. But here the potency was all right. When the patient is incurable, we prescribed a 30C. It helped relief for some time and then it was back to what it was, or it got aggravated from its present state. Now what happens? What do you do here? Kent says you have to admit you have made a mistake and then you reassess the case. Perhaps after the remedy, after a superficial remedy, the symptoms will come back changed. So you reassess the case and you prescribe the next best constitutional remedy. It is the best thing for the patient if the symptoms come back exactly as they were, but often they come back changed and you must wait and through the grievous suffering for the picture, and the patient will wait better if the doctor confesses on the spot that the selection was not it ought to be and he hopes to do better next time. So admit you have made a mistake, but at least not to the patient but even to yourself. Kent says admit it to the patient, but admit to yourself that you made a mistake and prescribe, do your best for the next best similimum. So that's about the fifth observation, and we come to the sixth observation now. Sixth observation is too short relief of symptoms. The amelioration didn't last for too long. You recall I shared with you in fourth observation what happens, that no aggravation with recovery of the patient. Now when you have no aggravation with recovery of the patient, you are always doubtful that whether it will go to the fifth observation where the amelioration comes first and the aggravation comes afterwards, or it will go to a sixth observation that there is too short relief of the symptom. The patient didn't get relief for much long. But when you get an aggravation in the beginning of the prescription, quick, short and strong aggravation, you are always sure that there is no chances of going to a fifth or a sixth observation. So with the sixth observation, too short relief of symptoms. Fifth I shared with you, where the amelioration comes first, the aggravation comes afterwards. Now with the sixth observation, there are a few factors which may cause it. One of the factors is errors on the part of the patient. So what you call as a maintaining cause. So he is coming to you for a cough. You ask him to be refrain from smoking. He's come to you for jaundice. You asked him to refrain from alcohol. He's doing something which interferes with the action of the remedy, which acts as a maintaining cause. So he's smoking, he's drinking, and that interferes with the action of the remedy. So it is an error on the part of the patient. The patient has done something to spoil the action of the medicine. That can happen. Too short relief of symptoms. That can happen. Now the second factor which is important to understand here is sixth observation in acute cases. Now what happens here? You prescribed to a child who is having 103 Fahrenheit fever, 102 Fahrenheit fever, high fever, and is shooting very quickly. You prescribed in belladonna, a 200C. and you find that the fever got better, but within 1 hour, within even in half an hour, the fever coming back again. So it's a violent inflammatory state which is helped with belladonna, but there is too short relief of symptoms. The symptoms are coming back again. So perhaps you need to repeat the potency again, or you may need to go to a higher potency so that the relief is permanent. In acute cases, we may see this too short amelioration of symptoms. For instance, a dose of medicine given in the most violent inflammation of the brain may remove all the symptoms for an hour, and the remedy have to be repeated, and at the end of that repetition, you find only an amelioration of 30 minutes. So you got better, but again the symptoms come back. So again there is need of repetition of the same potency, or perhaps you may need to go to a higher potency. Action of belladonna in some very acute red-faced conditions is instantaneous. In 5 minutes I have noticed the amelioration come, but the best kind of amelioration is that which comes gradually at the end of an hour or 2 hours, as it is likely to remain. If it is too short an amelioration in acute cases, it is because such high grade inflammatory action is present that organs are threatened by the rapid processes going on. So too short an amelioration, why? High grade inflammation, and that requires repetition frequently. So what can happen here, and what is important to understand here, especially in acute case, you need to understand the pace of the disease. I got out in the sun, I came back immediately within 1 hour, I got 103 fever. So it's a sudden onset. I came back from the sun, today I am feeling lethargic, tomorrow 99 degree Fahrenheit, next day 100. So it's a gradual onset of symptoms. So you have to assess the onset of symptoms, especially in acute case, and remedies will differ according to the onset. For immediate effect, you'll need belladonna, you'll need aconite, where the symptoms come suddenly and violently. And for gradual onset, symptoms have come gradually, bryonia, gelsemia. So the pace of the disease should corroborate with the pace of the remedy. Train is running at 100 kilometers an hour. You need a remedy which will stop that train at that same speed. When the fever has come suddenly and violently within half an hour of exposure, you cannot give bryonia, which has a very slow and insidious pace. It does not have the speed to go and catch that train. So the pace of the disease should corroborate with the pace of the remedy. The depth of the disease should corroborate with the depth of the remedy, and the magnitude of the disease should corroborate with the magnitude of the remedy, and that is very important to analyze. And you see, the reason of fifth observation is because the pace, the depth and the magnitude is not being addressed. You're prescribing a superficial remedy. Coming back to the sixth observation, so error on the part of the patient. Acute cases which require perhaps a frequent repetition or a higher potency which is needed. And sometimes Kent also mentions that this can happen in chronic cases as well. In chronic cases as well, if there are structural changes and organs are destroyed. So again, in irreversible pathological changes, when it is a superficial amelioration, when it's a partial amelioration, there can be too short relief of symptoms as well. So, corroborating with fifth observation as well, it's an incurable condition and you have prescribed a remedy which helped a little bit. Either it can follow the fifth observation, helped a little bit, but aggravation comes after that, or it can follow too short amelioration of symptoms. In the sixth observation, a little bit of help, but there's not much change after that, especially in incurable state, especially in a cancerous state in today's world. So these are the first 6 observations of Kent. We'll do another part where we'll talk about the next 6, 7 to 12 observations of Kent. Very important to know that, especially for a budding homeopath, or especially if you're learning homeopathy for the first time. And these are very important fundamentals which are unfortunately rubbed off or forgotten in clinical practice. Thank you.